Right, in tonight's health news, we are talking about a condition seen this time of year in many images of, say, Santa. It's called Rhinophyma, and it's a large red-colored nose that can often be sort of discolored and disshaped. Joining me now to talk about the symptoms and the causes is Dr. William Groff. Thank you so much for joining us, especially on the holiday. I was noticing your tie with Rudolph, and we sort of joke about Santa and sort of the big nose, but as we were talking a little bit more, I mean, this is a really serious condition for people.
Yeah, particularly the rhinophyma, because it can be very disfiguring and it can affect patients in their workplace. A lot of them will be so embarrassed that they won't be able to seek work or they won't go out in social situations. So as a doctor, it gives me a lot of gratification to be able to help these patients.
Right, and I know we have some photos to show people. These originally ones are sort of just of rosacea, right?
This is rosacea, yeah, and rosacea will progress into rhinophyma. These are patients that I've treated with a laser just one time to decrease their redness or their rosacea. Now you can see this gentleman has some broken capillaries on his nose, and I treated him. This gentleman I treated on the cheek, of course, and you can see quite a marked improvement. Now when we get to the nasal or the nose shots, you'll see quite a transformation in the patients who do suffer from rhinophyma. I think they're coming up. Here's the first gentleman's a more mild case, but you can see the difference in his nose is quite nice. All the bumpiness, lumps and bumps are kind of smoothed out. Now this gentleman had a really bad case. I treated him one time under local anesthesia, so he was awake when I was doing the treatment, but we were able to transform his life quite a bit by giving him a normal nose again.
Right, I can't imagine. I mean, I'm sure it is a really blow to your sort of just self-confidence and not wanting to go out. Is there something specific that causes this in the sense of behaviors or things that you're doing every day that maybe make this worse?
Well, it's really the cause, it's usually in your genetic or in your genes, passed down from generation to generation. There are some things that can exacerbate rosacea and lead to rhinophyma, like intake of alcohol in excessive amounts, drinking a lot of hot beverages like coffee or tea, excessive sun exposure. All these things can contribute to the development of rhinophyma and rosacea as well.
So what are the cures? I mean, you mentioned the laser treatments, which seem to do some pretty incredible work, and I would assume if it's that extreme, you're going to need some type of surgery. But are there other things that people can do if they're starting to notice it?
Well, once it really starts to take hold in the 30s, and then develops through the 40s and 50s, and once it kind of progresses, really the only treatment is some kind of procedure. But the advantage of using lasers is that it can be done under local anesthesia. There's no general anesthesia required, and it's one treatment, and you get a pretty amazing result, and you just have about a week of downtime.
Wow, yeah, definitely worth it for someone to be able to feel more comfortable to go out.
Yeah, absolutely.
Yeah, Dr. Groff, thank you so much for joining us. Merry Christmas to you.
Thank you.
Andrew, we'll send it back over to you.